I want to bring up the issue of counterfeit PPE that's flooding the market from many sectors. And now we have the pleasure of a clinical engineer from Brazil, Benedito Fernandez de Lima, who's going to talk about the complex area of ventilators and anesthesia machines, which we know, by definition, become contaminated with COVID-19 patients. Welcome.
Okay, thank you. Because of coronavirus pandemic, it was necessary to create new protocols and change the other ones concerning the sterilization and disinfection of ventilator and anesthesia items. Next slide, please. Regarding ventilation, we adopt a new process such as we began to use only disposable breathing circuits because it helps to reduce the contaminated items when supported inside the hospital. So it is discarded as infectious biological waste. This way, avoid increased contamination. Although we have used disposable high-efficient particulate air filter, known as HEPA, connected to the intubation cannula. We have also started using ventilation equipment with HEPA filter in exhaling circuits. In this case, only ventilation equipment with double circuits are permitted because it's possible to install HEPA filters at the end of exhaling tube. However, most filters are capable to filter up to 0.3 microns, and no manufacturer guarantees that the filters will retain coronavirus. Despite considering that manufacturers report there are several factors that can trap the contaminants in the filter. Many ventilation equipments now started to be used only within patient coronavirus. When we started the sterilization process of exhaling valve, we had a decreased valve lifetime and more problem of liquid occurred, and also more exposure of the clinical engineer team to contamination, considering that when there is problem, the first assistance is done with the equipment work with the patient, and only after to take a better decision, that is to replace the equipment or try to solve the problem with the equipment connected to the patient. Bear in mind that no always there are another equipment available. Because of that, it's necessary more training course of the team. Next slide, please. Regarding anesthesia equipments, we need to relocate a lot of equipments before using with outpatients, and now they are used only in patients with coronavirus. So we had to choose an anesthesia equipment with the least difficult level for reprocessing. One of the great difficulties was disassembling process of subsystem of anesthesia and send it for sterilization and then to be reassembled, considering that the assembling and the assembly process is carried out by the clinical engineer team. The devices become subject to right temperature and pressure, so it is necessary to double check the integrity of the equipment after reassembling it. Next slide, please. Before slide, please. Before. Okay. Some equipments have about 20 parts to disassembly, sterilize, and then reassembly. Moreover, the flow sensor not bear the sterilization process. So they are immersed in alcohol to be disinfecting according to the manufacturer's manual. even though they passed through sterilization process. Some anesthesia equipment are only used in patients with coronavirus. This way, increasing the safety. Relating to soda lime, known as carbon dioxide absorber, it was necessary to change the disposal process. It became infectious biological waste. Before it was considered as corrosive waste. This way, it is necessary to use personal protective equipment, or PPE, to avoid the biological contamination. Before coronavirus pandemic, we used to make sterilization when the equipment were using infectious respiratory diseases. When the coronavirus pandemic started, it was necessary to create new protocols to process these items at the sterilization central. We defined to process the contaminated materials with coronavirus separate from other items not contaminated. That is, when we process these items, the sterilization central stops to prioritize the process items with coronavirus. Another difficulty that we found was to dry the subsystem of anesthesia, because these items, there are many parts that is difficult to dry, and with great demand, the time gets short. We dry these items with compressed air jet. This causes much damage in the equipment. It was necessary to increase the sterilization process time. And it demands to get more subsystem, and the most efficient one is also the most expensive, almost twice the price. At the beginning of the coronavirus pandemic in Brazil, we did not have appropriate quantity of ventilator to supply demand. And also the number of surgeries reduced about 90%. So we had to relocate many anesthesia equipment to take care of coronavirus patients. Because of that, we defined the safe way to use the system with capture system for leftover gas from anesthesia equipment, even using filters, disposable breathing circuits, and subsystem sterilizer. That was the way we found to improve safety, avoiding the dispersion of contaminants in the air. Okay, thank you very much for the opportunity.
Fernando, thank you very much for being here. Thank you for your hard work in Brazil and in protection of patients and your staff, and for sharing your information.